Welcome back to the second half hour of the HealthCall Live Radio Hour. This is the week that the COVID-19 virus got real for many people. The state of Indiana recorded its first confirmed case. The virus known now to be in half of our 50 states, but let's face the facts. It's probably more widely spread than that. We just aren't testing well enough yet to really get a handle on things. But there's another concern here about the COVID virus that I think we're going to jump into in detail this half hour, and that is the stress and strain that it could put on our healthcare system. It is not only a threat to our families potentially, but it's also a serious threat to the entire healthcare system. It could be swamped if the disease passes through your community in a big wave. So let's jump on the HealthCall expert line and shoot out to California, where Dr. Cedric Jaime Rutland is a triple board certified in internal medicine, pulmonary and critical care. He's a national spokesperson for the American Lung Association, and I'm glad to have you back. Thanks for being with us, Jaime.
Hey, thanks for having me this morning. Good morning, everybody.
Have you seen a COVID-19 patient yet in your care?
So in our care, what we have seen is we've known about a patient. So being in the intensive care unit, we have to know about patients and potential threat to be admitted to the ICU. And so in that sense, I have known about a patient. I have not directly cared for a patient. I've indirectly known the plan of care and known what we've done.
We have learned an awful lot about this virus, and we can talk about some of that in a moment. But for you at this moment, what strikes you about its danger level? What makes it so dangerous?
So, again, as I talked about last time, what makes the virus dangerous is the fact that it infects your airway cells, right? Your lung cells, which have a certain receptor on it, which leads to pneumonia. But moving forward, what's interesting about the statistics is when you go to the country that has the second largest number of cases, which is South Korea, and you look and you see they have about 7,000 cases, but they only have 44 deaths, which puts their mortality rate at about 0.7%. But that's because their testing system is great. They've tested well over 100,000 people in their country. And so it increases their denominator, thus lowering their mortality rate. And so, again, I think, we all are afraid because of the mortality rate that we're seeing, which is, anywhere from 1.4 to 3.6%. When you go to the epicenter of this outbreak, is 3.6%. But again, I think that N, or that denominator, is a lot larger, like it is in South Korea, and it's going to bring that mortality rate down. So I do find some comfort in looking at that.
So you were, talking about denominators there, and we're getting into a math problem, but that's where I think we need to focus, because that's really the challenge for guys who do what you do, right? My understanding is the big concern among the healthcare community is you could get swamped if this virus swipes through a community, right?
Yeah, we could get swamped. And what you mean by getting swamped is we could get exposed to many people with viruses, right? So if the healthcare system gets exposed to people with this coronavirus, then we spread it throughout the hospital. And what's scary about that is, remember, the hospital takes care of very sick people. Mm-hmm. So those are the people who aren't doing well with it, or the people who are very sick. And so that's our worry. So what we've done at hospitals where I attend is we have basically increased the screening. And so people that even enter the hospital, we ask them, do you have any symptoms of X, Y, Z? And if you do display symptoms of, coronavirus, significant symptoms of a coronavirus, we will kind of divert you into an area of isolation, into areas where other people might be displaying these same symptoms, and then we'll get tested that way. And so that is the burden that could possibly happen, is that you have a lot of healthcare providers that are exposed to virus, and then they thus spread the virus because they're taking care of many people. And that's where I see the problem that could potentially happen.
What about capacity alone? How many people can you handle in isolation? How many people can you handle on a ventilator?
Yeah, that depends on your institution and how many ventilators you actually have. So at one of my institutions, I've got 34 ventilators, right? And I've got 40 anesthesia machines, which are basically ventilators as well. And so I only have the capacity to handle about 74 people that can be ventilated. Fortunately, unfortunately, it's not that everybody with coronavirus gets ventilated. It's actually reported now that 80% of these people are actually going home, I believe, and isolating themselves at home. But that could lead to significant burden on our care that we can provide, because we only have so many ventilators and we only have so many negative pressure rooms. A negative pressure room is a room in which you don't recirculate the air you're breathing out. You kind of suck it out of the room and put it elsewhere. So you are thus getting rid of some of the molecules and the antigens that are in the air and getting rid of viral particles.
Hey, Jaime, we've got a question that's come in on the text line. I'm going to bring Heather, our producer, on board here. Heather, what's that question?
Well, it says, my son in LA got the coronavirus last week, was extremely, I believe he said, sick the first 3 days, continuous coughing, diarrhea. His roommate was the same, but without diarrhea. He's still coughing a lot, but much better after 9 days. He's healthy, age 45, and said it was very, very bad.
So that GI tract exposure is not unusual, is it?
No, we've actually noticed that perhaps the virus is shedding within the GI tract, which is why it is so important to wash your hands several times a day. It is really important to wash your hands so you can get that virus and those virulent bacteria off of your hands and down the drain.
I want to talk a little bit about, so you've got a patient on a ventilator. How much care is involved? Is it one-to-one? Do you almost have to assign a staff member to follow that person?
Yeah, so, that's one of the things we did in our hospital is we only had one doctor following that person, right? And in that case, it was the infectious disease doctor. And if you get to the point to where a person is requiring a ventilator, that's what we would do, is we would try to minimize exposure. So we would make sure that it was one-to-one. We would make sure that it was only one physician following the patient, actually seeing the patient every single day. And we would make certain that there are a minimal amount of people being exposed to that room, because it is important for those people not to spread the virus. They would have personal protective equipment that they would have to put on every single time they entered the room. We would have certain masks that they would have to wear that are kind of a negative pressure mask where it sucks out the antigen from where you're actually breathing in and spits it out elsewhere. So we are prepared for that. And actually, when I go into hospitals, I'm getting trained on certain personal protective equipment as I walk in, and when I'm in the ICU, they're like, hey, the respiratory therapist will pull me aside and say, hey, I need to train you on this certain device, this certain mask, so that way if this ever happens, we take care of the patient appropriately.
So that's got to be I'm putting myself in your place here, buddy. If I've got to be in PPE all day in my shift, and it goes on week after week after week while this epidemic rolls through our population, that's a lot of stress on you guys.
Yeah, it's a lot of stress. What you have to think about, though, is the PPE we're using for a certain period of time when we're in that person's room. Then we take off the PPE equipment in like an intermediate area, and then we wash our hands, wash our body, wash our face, and then we exit the premises, we exit the room. And so in that sense, it's not that we're in the PPE all day, it's just that for that period of time we're in the PPE. Now, thinking in my head, I'm wondering what I would do if I were in that situation. Then I would actually maybe see that patient first thing in the morning, wash up, and probably not have to enter the room unless the patient develops a severe acute type of scenario in which I need to be at that bedside. Most of the time, I'd be monitoring the patient with the monitors that we have hooked up to the patient's body.
Dr. Rutland, the greatest risk so far is to the elderly with comorbidities, other conditions, but it's not just having a condition, it's being weakened by that condition, right?
Yeah, exactly. So, for example, for the elderly patients that are, I always joke with my patients, or not joke, but I always say to my patients, you're very wise, meaning they're up there in age, 75, 76. And again, when you increase the exposure to the environment, increase your organ exposure overall, your organs are going to deteriorate over time. One of the things that happens naturally in your lung is called emphysema, which is kind of dead lungs. So you're losing your capacity capacity to breathe, right? You're losing the amount of balloons you have in your lungs, so to speak. If you're a huge smoker, that capacity is further reduced. Knowing that a virus like the COVID-19, or what we're now calling the SARS-CoV-2 virus, knowing that this virus specifically infects airway epithelial cells as a result of the receptor that's present on these cells, if you infect that airway epithelial cell, that lung that has a reduced capacity to do its job, you are now putting your life at risk because you cannot perform that end organ's ultimate function, which in most end organ cases is to keep you alive.
Sure, yeah. So you've got less to lose starting out with. You're already behind the ball.
That's correct. You're behind the 8 ball already. This is where you're starting from.
Yeah, wow. So we have a person in our family. She's 86 years old. We have some people coming in to provide at-home care. And we're specifically instructing those people, first thing you do when you walk in the door is wash your hands. That's about the only thing I know to do to help her in the home. Is there something I'm missing? What else can we do if we're caring for an elderly person?
So if you're caring for an elderly person, I think the most important thing is screening. Who's coming in and out of the house? Are there young children coming in and out of the house? If they demonstrate any symptoms of a cough, I wouldn't expose the elderly person to those young children. So again, my wife and I like to go out. We like to have a good time. We like to go to dinner. If my kids are sick, I can't leave my kids with grandma because grandma has lung disease, right? Mm-hmm. So that changes my social plan. And that's what you have to do. Of course, you're going to wash your hands. Of course, you're going to take off your shoes. And what I tell my kids when they come home from school is I want them to change their clothes. Put them in the laundry. Let's get them in the wash. Change your clothes. Wash your hands before you move on. The type of bacteria and viruses on your hands and feet is to wash your hands. And then the best way to protect your loved ones, your elderly loved ones, is to decrease their exposure, reduce their exposure to illnesses.
So about 80% of people are projected to have a severe cold or mild flu experience as this virus passes through. The rest of folks could see something even worse. If I'm at home and I know the virus is in my family, what's a trigger? What's the sign that I need to go get care?
You know, that's an interesting question. In my mind, if you're at home and you know that somebody in your house has the virus, I mean, I'm one of those guys that's like, I would assume that you have the virus. I would tell the CDC and I would get a testing kit and I would test myself. I don't know if I would go to the hospital in that sense and actually go get tested at the hospital because there's a high likelihood that I probably have it, especially if I'm within 6 feet of this family member at all times.
Yeah, so essentially if somebody in the house has it, you're going to have it, right? I mean, let's just face that fact, right?
Exactly. It's just like the story or the question that we had in the previous segment where the roommate had it and then the other roommate displayed symptoms. So they both probably have it. And so it's important where if you can take care of yourself at home, you're not requiring life-saving products, right? You're not requiring significant amount of oxygen. You're not requiring significant resuscitation. You can still eat and take care of yourself. You should stay home and stay isolated. That is, you need to stay at least 6 feet away from other family members. And I know that can be tough to do in certain social situations. And in that sense, if that's tough to do, then we got to let the CDC know to see if we can come up with an alternative. And that's where I can see possibly a problem with outbreak. Not everybody has the space to isolate themselves. So that's a worry.
I'm treating somebody at home. We're all doing fine. And then what's a trigger that tells me this thing is going south? What are the symptoms that I need to watch for that says, okay, this is out of control. I got to go get additional help?
Extreme shortness of breath, extreme high fever. We're talking 103, 104 degrees, because sometimes as a result of a high fever, you can have a seizure. Not that this has been reported in this virus, but these are the things that I would watch out for at home. Night sweats, chills, extreme shortness of breath, extreme pain in the back. Because we got to remember, just like with influenza, you can develop a secondary bacterial pneumonia probably on top of a viral pneumonia that you're displaying or that you have. So your immune system is so concentrated on trying to get rid of this virus that it doesn't survey some of the bacteria that are in your system, and you develop a bacterial pneumonia in that sense. And so I think if you're displaying severe symptoms, really high fever, extreme back pain, really short of breath, right, inability to take care of yourself, eat and drink and keep up with fluids, those are the symptoms that I would say, all right, you need to go to the hospital and seek medical care. And the first thing you got to tell them is, I have SARS-CoV-2 or COVID-19, and they get you isolated in an area so you don't expose yourself to other people.
I can buy a pulse ox sensor, the little thing that slips over the end of your finger that measures the amount of oxygen in your blood for like, what, $20-$30 at Walmart? I mean, you can pick these things up anywhere. Should we have one of those around, and how do I use it?
That's a good question. I think for me, I would have one of those around for people that have significant lung disease, right? So if you're a healthy person and you get this virus, odds are in your favor that you're going to be just fine. You're going to be sick for a while. You're going to have cold and flu-like symptoms for a couple of days, and over the course of 7 to 10 days, you're going to feel better and you're going to be fine. If you have significant lung disease, you have asthma, you have emphysema, you have chronic bronchitis, you have interstitial lung disease, you're immunocompromised, I do think it's important for you to have appropriate monitoring material, because sometimes people will saturate in the 80s, which is abnormal, right? Anything less than 88% on room air is abnormal. And you can only know about this if you have a pulse oximeter, because sometimes you just feel fine because that's what you're used to, right? You might always be saturating 88%, but when you get a virus like this, it might bring you down even further. And the only way you're going to know is if you have a testing device like this.
Yeah, so think about that. And again, they're relatively inexpensive, easy to use. You can find them lots of places. Run this out for me, Doctor. What do you see happening here in the next couple of weeks?
So here's what I think will happen. I actually think that denominator is going to increase. I think that as testing expands, that denominator is going to increase. So more people are going to have this infection than we believe to have it now. But I actually think the mortality rate overall is going to drop. And so I don't know if it's going to approach the flu mortality rate, which is around 0.1% or so. But I do think that mortality rate over time is going to drop. I do think that more cases are going to pop up, and I think that we're going to find that most people, right, over 80%, 85% of people display mild type of symptoms, and the people that we have to worry about the most are the same people that we have to worry about the most in influenza, right? It's the elderly, the immunocompromised, people who don't have an immune system that works very well. And so I do think that that's what we're going to see. I understand the worry, because I think what scares people is that we don't have a quote-unquote treatment, an evidence-based treatment, because the studies haven't been completed yet. And I understand that part, but at the same time, if you understand how your immune system works, you can understand that most people within 7 to 10 days are going to improve and are going to get better.
That's we'll leave it there. That's a positive outlook. Thank you very much. That's Dr. Jaime Rutland from the National Spokesperson for the American Lung Association. And if you'd like to share this program, you can always look for a copy of it on your favorite podcasting service. Just search for HealthCall or visit our website, healthcall.live. I'll have links to a video version of the interview there, and we will see you next week.